like, they're like consultants throughout. And everybody else.
So I was like, well,
But she had a
you know, out of my.
Smith for him. I had that, I'm pretty sure she's. But I'm pretty sure all that stuff is kind of.
Okay.
It's
Funny, because I never got acquainted with it. Talking around again.
Yeah, oh, okay. Yeah. You have to go.
Yeah, like all these changes. Stuff. And then you're at this.
Paycheck.
I know that.
Indiana was not right. I like chose the long, wrong path. You know, I was trying to do it. And I don't know, switching back, keep on to one order. And like also wiring, ordering the entire. Good morning, everyone. Right, yeah. It was, they were like, trees in the corner. I was like.
I just not.
But this is.
Is that why you're applying to other positions?
Got it.
Not so much. Counselor, yeah. I see clients that are up to work, I got that, the three.
You still want me to join that one though, right?
Yeah, so we tell Brittany to move over?
Yeah.
So I get that at 9.
I didn't know where you email everybody to tell.
You start with that, I gotta put away. I got that at work.
Pam, you can only do so much.
I can't believe Cam is live streaming right now.
Part-time.
For vlogging and that.
All reoccurring things.
My privilege to push me away from the state. Like, we're gonna do that whole a year and a half service loan that, that's still intact.
So what's next for you?
Well,
What
are you
doing?
Excellent.
I had applied for food. And it came early, like I've had it for like 2 months. I gotta pay.
Yeah.
I owe 2 months. But I have to, when I've been speaking with Agnes, so that I can distribute them out. My magnets are heavy. You can't.
Retirement.
Pam gave me an hour drive, right, from this RE.
I thought they know, yeah. So, my social work, yeah, they, like, they'll feel the need after 6 months, I'll like.
Well.
I'm on your, I'm on my bootstrap.
All the things that were going on.
Yeah, yeah.
And somebody.
If you give a good one, and I'll come with you. Oh.
One more time. Right now,
Oh,
because.
Okay.
Yeah, because it's there.
Perhaps your travel takes you
The rest of the way.
somewhere else.
Yeah.
Yeah,
Somewhere away.
My grandchildren.
not today, but someday.
Posted hiring for a position above there. I was going to apply for this position, not. They moved the person above me up one. Well, very full, obviously, she got it.
Yeah.
But yeah, no,
Yeah, no, it goes, yeah, it goes all the way to your mom.
I was just thinking, we market and try to get.
And then there's some
If I were to
external.
leave the US.
hard share travel.
Right now, I got my current.
So there's always spirit magnetic.
Friends that moved there, yeah, yes, they bought a castle and it's an Airbnb, well, BB, BB there. Yeah, I know, like, just living the dream, like, what town?
Oh, for sure.
I couldn't pronounce it to you, even if I did know.
Yeah, 'cause I was looking at
A whole different world.
And so he acquiesced, and then, so here's the address. I'm really excited about this, and I'll carry it on. Yeah.
How that
Yeah.
is.
Good morning, everyone. It's
Yeah.
9:00.
Start off with it.
Shall we get started?
What's trouble now? You can go. I know.
Please help yourself to, donuts, the little cake and coffee over there on the table. Welcome on this lovely Friday morning. We are in open session for the statewide CFR team. And here's our agenda for the statewide CFR team. Please be advised that this is a public meeting in accordance with open door law that is being live streamed to the public and recorded. The recording will be archived and available to the public for no less than 90 days. By attending and participating in this meeting, you acknowledge and consent to the live streaming and recording of the meeting, including your image, voice, and any contributions you make. Everyone in the room in agreement? Yes. Anyone virtual? If you do not agree, you need to log off now, please. Thank you. Again, welcome to statewide CFR. And I want to do introductions first so we can all get to know who's here. I am Pam Ashby. I am the Child Fatality Program Director with the Indiana Department of Health. Gwen, would you like to go next?
Yes, hi, I'm Gwen Strickland. I'm the Violence Prevention Program Evaluator for the Indiana Department of Health. Good morning, I'm Jennifer Watkins. I'm the Southern Child Fatality Review Coordinator for the Indiana Department of Health.
Good morning, everybody. My name is Jessica Morris. I'm the Suicide and Overdose Fatality Programs Director here at IDOH.
I'm Taylor Rubel. I'm the manager of the Office of Traffic Safety at INDOT.
Jim Oliver, Indiana Prosecuting Attorneys Council.
So Shanna Everhard, I'm the Director of the DCS Ombudsman Bureau. Melissa Haywood, DCS Fatality Team.
Jamie Smith, I'm the Director for the Division of Family Health Data and Fatality Prevention at IDOH.
Blake Froberg, Medical Director, Indiana Poison Center.
Olivia Hessler, Adolescent Fatality Prevention Coordinator and DSP at IDOH.
I'm Abby Hummel. I'm the Infant and Child Fatality Prevention Coordinator with DSP at IDOH.
I'm Jason Murray. I'm the prevention specialist at the Department of Education.
I'm Mallory Lown. I'm the Fatality Review Epidemiologist with CFP at IDOH.
And I'm Allie Houston. I'm the Prevention Programs Director with DSP.
Thank you. Dr. Kaur just walked into the room. Would you like to introduce yourself, Dr. Kaur?
Dr. Kaur, forensic pathologist.
Thank you. For you folks that are virtual, I will try my best to call your names off to introduce yourself. Darlene Hatton. Remember, can they unmute to do that? Oh, my apologies. Can you introduce yourself in the question and answer section?
Yep.
You're not able to actually unmute yourself to do that.
They cannot mute and can't put anything in the chat.
Is there a question and answer section they can put things into?
I see one.
They can hear you.
My apologies. This is a first time of doing the live streaming, so there might be some walls that we run into. So there's no way for them to introduce. There's a question and answer. So if you could please put your introductions in the question and answer section, I would appreciate it.
They're putting them in there.
Thank you. Keep those off, Ally, because not everyone has a computer, and we'd like to know who's actually.
Sure. Angelica's on. She's with DFP as a fatality data specialist. Alex is on here. She's the Northern CFR coordinator with DFP. Susan Greider's on there, and she's with DCS Central Office. Alexis from DFP is the Stewart SDY program manager. Brenda Chapin is with the Villages of Indiana, Child Abuse or Prevent Child Abuse Indiana. And then Brittany's on. She is with DFP. And then Jeff Whitman is with Prevent Child Abuse Indiana. Tanya Merritt Malamba, she's with the Division of Mental Health and Addiction. Mark Fairchild on Commission on Improving the Status of Children. I think that.
If you didn't hear your name, would you please make sure you put your introduction in the question and answer section? Thank you. Vision and mission. Our vision is understanding the circumstances causing a child's death will help prevent other deaths, poor health outcomes, and injury or disability in other children. The mission statement, the Statewide Child Fatality Review Committee will work to support the local child fatality review teams by providing guidance, expertise, and consultation in analyzing, understanding the causes, trends, and system responses to child fatalities, and to make recommendations in law, policy, and practice to prevent child death in Indiana. First, we will do statewide CFR committee business, and these are some information that I actually had on here. You all received an email as far as the team members that this would be a public meeting that would be live streamed, and this is the code that was passed as of July 1st. The Indiana Code IC 514 1.5 requires governing bodies of state agencies to provide live transmissions and archived recordings of public meetings on a publicly accessed platform. This is part of our continuing commitment to transparency and accessibility in government operations. Any questions about that? The statewide CFR committee requirement is an archived copy of each meeting's agenda, minutes, and memoranda will be available online. Nominations have been submitted to the governor's office for the Dr. Shannon Thompson for the chair position. Right now she's acting as interim. And also for the DCS position is Joseph Sims. We have not heard anything back on those nominations, except that they're working on getting those put through. Shoshana's last day is today. Everybody, thank you, Shoshana, for all the years that you have been a part of statewide CFR.
Thank you to all of you.
And thank you for the cake. You're welcome. And for all your DCS work over the years. You want to tell everybody, how long were you with DCS?
Well, I was with DCS for 15, right out of college, and then the last 5 at the Investment Bureau. But then I've always been a social worker with children and families. So 45 years. Wow. Yeah. So, but thank you very much.
Lots of hard work working with children and making sure that children are safe and they're healthy. Thank you again. Is there any other team business? Anybody have anything that they would like to discuss? Any questions about anything?
I forgot to say that they do not have a replacement for my position yet, but it is in statute, so they will fill it at some point. Hopefully sooner rather than later, but.
Can you leave them any kind of message to like, let me know who it is, or?
I can. I'll tell my team because they know about this team. So I'll do that.
Okay, thank you, Shoshana. Dr. Crowder, I think you slipped in, and would you like to introduce yourself?
Yeah, morning, everybody. Guy Crowder, Chief Medical Officer, Indiana Department of Health.
Thank you. Are there any questions in the question and answer section?
No, just a few more people introduce themselves, but I wrote that down for you.
Okay. Does anybody have anything virtually that they would like to talk about or any questions? If you do, please put it in the question and answer section. We'll give them a few minutes to respond to that. Thank you. If no one has any further information that they would like to discuss for statewide CFR, that would end the open session and statewide CFR business. Anything? We will be moving to the closed session, so the webinar is ended. Thank you, everybody, for coming. We appreciate you having interest in statewide CFR.
Work, Pam.